Have you been told that you need an ACL reconstruction? If so, one of the most important decisions you and your surgeon will make is the choice of graft. A graft is the tissue that will replace your torn ACL. Many patients are unaware that there is more than one graft option available. In fact, there are several different grafts that can be used, each with its own advantages, disadvantages, and scientific evidence. The purpose of this video is not to tell you which graft to choose, but to help you understand the options so that you can have an informed discussion with your surgeon. The four main graft options are hamstring tendon grafts, bone-patellar tendon bone grafts, quadriceps tendon grafts, and allografts, which are donor grafts. Let's start with the hamstring tendon graft, which is one of the most commonly used grafts worldwide. This is usually taken from the semitendinosus tendon, sometimes along with the gracilis tendon, through a small incision on the inner side of the upper tibia. The tendons are folded to create a strong graft. Traditionally, surgeons often used a 4-strand hamstring graft. However, many surgeons now create 5 or 6-strand grafts when possible. My personal preference is usually a 6-strand hamstring graft because it can provide a larger graft diameter. The advantages of hamstring grafts include smaller incisions, less pain at the front of the knee, less discomfort when kneeling, and excellent long-term outcomes. Most patients regain good knee function and successfully return to sport. The disadvantages are that harvesting the hamstring tendons can result in some reduction in hamstring strength. Although this is often not noticeable in everyday life, it may be relevant for certain athletes. There can also be a small amount of graft stretching over time, and fixation of soft tissue grafts can be technically different from grafts that contain bone blocks. The next option is the bone-patellar tendon-bone graft, often referred to as the BTB graft. This graft uses the middle third of the patellar tendon, together with small pieces of bone from the kneecap and the tibia. Many surgeons regard the BTB graft as the historical gold standard, particularly for young athletes involved in high-demand pivoting sports such as football, rugby, basketball, and skiing. One of the major advantages of the BTB graft is bone-to-bone healing. Because bone heals directly to bone within the tunnels, fixation is extremely reliable and healing may occur more rapidly than with soft tissue grafts. Several studies and meta-analyses have shown excellent stability and slightly lower re-rupture rates compared with some other grafts. However, BTB grafts also have disadvantages. Patients are more likely to experience pain at the front of the knee, discomfort when kneeling, and pain during activities such as squatting. There is also a small risk of complications such as patellar fracture or patellar tendon problems. For people whose occupation involves frequent kneeling, these issues may be particularly important. A third option that has become increasingly popular over the last decade is the quadriceps tendon graft. This graft is taken from the tendon above the kneecap and may be harvested with or without a small bone block. The quadriceps tendon is thick, robust, and often provides a larger graft diameter than hamstring grafts. It has gained popularity because it combines some of the advantages of both hamstring and patellar tendon grafts. Patients tend to have less kneeling pain compared with BTB grafts while still benefiting from a strong and reliable graft. Recent studies have shown excellent outcomes with quadriceps tendon grafts, including good knee stability, high patient satisfaction, and successful return to sport. The disadvantages include temporary weakness of the quadriceps muscle and some discomfort around the harvest site during the early recovery period. Although it is becoming increasingly common, some surgeons may have less experience with this graft compared with hamstring or BTB grafts. The final option is an allograft. This is tissue obtained from a donor rather than from your own body. The main advantage is that no tendon needs to be harvested from your knee. This can result in less postoperative pain and a quicker initial recovery. Surgery can also be technically simpler in some situations. However, the scientific evidence consistently shows higher failure rates in young active patients, especially those returning to pivoting sports. For this reason, allografts are generally not recommended for young athletes undergoing primary ACL reconstruction. They may be useful in older patients, revision surgery, multi-ligament injuries, or situations where previous graft options have already been used. So what does the scientific evidence actually show? Large systematic reviews and meta-analyses demonstrate that hamstring grafts and BTB grafts both provide excellent long-term outcomes. BTB grafts tend to show slightly lower graft failure rates and slightly better objective stability measurements. Hamstring grafts tend to result in less anterior knee pain and less discomfort with kneeling. More recent studies on quadriceps tendon grafts have shown outcomes that are at least comparable to both hamstring and BTB grafts. Several studies suggest that quadriceps tendon grafts may provide similar stability with lower donor site problems than BTB grafts and potentially lower failure rates than smaller hamstring grafts. The reality is that there's no perfect graft. Every graft involves a balance between benefits and drawbacks. A young elite footballer may choose one graft. A recreational runner may choose another. A builder who spends a significant amount of time kneeling may have different priorities from an office worker. Someone undergoing revision surgery may require a completely different approach. This is why one of the most important questions you can ask before surgery is, what graft are you planning to use and why? A good ACL surgeon should be able to explain the rationale behind their recommendation. They should discuss the benefits and limitations of the graft they are proposing and explain whether alternative options may also be suitable. You should feel comfortable asking questions such as, what graft do you recommend for me? Why do you think this is the best option in my situation? What are the advantages and disadvantages of the alternatives? Do you routinely perform ACL reconstructions using hamstring, patellar tendon, and quadriceps tendon grafts? What has been your experience and outcome with these different graft choices? The answers to these questions can help you understand whether the recommendation is based on your individual needs or simply on the surgeon's preferred technique. It is important to remember that graft choice is only one part of a successful ACL reconstruction. The accuracy of tunnel placement, graft size, fixation method, rehabilitation program, muscle strengthening, and safe return to sport are all equally important. The goal is not simply to reconstruct the ACL. The goal is to restore confidence, stability, function, and allow you to safely return to the activities that matter most to you. If you are considering ACL reconstruction, make sure graft choice is part of the conversation. Understanding your options and discussing them with your surgeon can help you make a more informed decision and ensure that the chosen graft is the right fit for your knee, your sport, and your lifestyle. Thank you for watching. If you found this video helpful, please like, subscribe, and share it with anyone considering ACL reconstruction surgery. Understanding your options is the first step towards achieving the best possible outcome.